My name's Graham Bayliss. I'm lay member for Public Patient Engagement for South Sefton CCG and I co-chair EPEG.
EPEG stands for Engagement and Patient Experience Group. My name is Jill Brown. I'm governing body member for Southport and Formby CCG and I'm the lead for patient and public involvement.
EPEG's a meeting made up of partners from across the borough, so taking in the local authority, Health Watch, carers and various other organisations. And what we try to do is look at how we engage with public and patients, and not only from the CCG's perspective, but also from the providers, so that's the acute trusts and other providers within the borough.
I'm Diane Blair and I'm the manager of Health Watch Sefton. We've attended meetings of the EPEG since it started really, and our role is to make sure that the feedback we get from the public is actually fed in, just to let commissioners and providers who are there know exactly what the public is saying. If commissioners are planning to engage or consult with the public, we can offer them some support in terms of what groups they may be able to go to. We've got 2 community champion networks, one in Southport and Formby and one in the South Sefton, and we can support facilitation of engagement with those voluntary community faith sector groups. Also offer advice and support on, from what people have told us previously about what works and what doesn't work.
EPEG reports via the CCG's management structure to the Quality Committee, and also myself and my colleague are on the CCG board. So in that way, any issues that are raised at EPEG, we can actually take up the management structure and ensure that they're addressed.
From feeding in feedback from the public, the responses we get can sometimes vary, and I think it's really good that when we come to EPEG we're seen as a kind of partner with the commissioner, and commissioners can actually take those issues that maybe we as an independent organisation struggle with and actually escalate them. For example, I know some of our reports have gone to the CCG Quality Committee and they've been able then to have those conversations directly with the providers through contract meetings and get answers back for us, but on behalf of the public.
My name's Simone McCaskill and I'm the Policy and Impact Officer at Sefton Council for Voluntary Service. We're a local charity. A Council for Voluntary Service provides infrastructure support to the local voluntary sector. We've got over 1,000 voluntary sector services being delivered in Sefton, the majority of which have been developed by local people responding to local issues. EPEG, I think, is particularly useful for CVS in respect of us being able to enable the local voluntary sector to engage in key policy areas, look at how they can develop and shape local services that meet the needs of local people. Our young advisors have been involved in things like youth proofing resources so that our youth population can be engaged in consultation and have their say. We do run a range of networks. We have a health and social care forum, the Every Child Matters forum. Both of them are representative of service providers in the borough. We support a range of equalities networks, 3 in particular. There's Intrust, which focuses on LGBT and trans. We run an Embrace network, which also focuses on the voice of LGBT. We also run an Equal Voice network, which focuses on those from BME communities, those experiencing migrant issues and asylum. And again, those networks all form part of the Sefton Equalities Partnership, which feeds into the CCGs and also the local authority.
The highlight for me and the joy of it is that we hear from all those different communities by this wider stakeholder engagement model that we've gone for, and that's so important because not everybody can engage with our services the way that maybe I would. So it reminds me to think of everybody, our whole population, and particularly, if I'm honest, about those groups that have more difficulties trying to engage with our services.